Dental imaging has come a long way from just a few years ago. We don't have to look at a two-dimensional view of things and do procedures in 3 dimensions. We don't have to make any guessworks anymore. We don't have to assume what's going to be there and be surprised once you start doing the work. Traditional x-rays, when you take an x-ray, it puts a 3-dimensional object into 2 dimensions. We only see a part of what's there. Now, how can you make an accurate diagnosis knowing just a part of what you're dealing with? So 3D imaging, it gives you the most accurate available information of the jaw, of the soft tissue available today. So we don't have to make any guess measurements. When we're talking about placing implants, we're dealing with sensitive part of the body. And if we go in just a tiny bit deeper than we're supposed to go, that can cause major problems. You can have numbness, it can cause major bleeding. So it can lead into major issues for the patient, and you can have major consequences. By having the 3D imaging available in the office, patient comes in here, they want to place an implant, they want to do a surgery, they want to remove an impacted tooth, and we can take an image of the area and know exactly where everything is. So up front, we'll know the risks of doing the procedure, so that can be explained to the patient, so the patient can make an informed decision as if they want to do the procedure or not, or if the risks outweigh the benefits, or the benefits outweigh the risks. So it's about creating informed decisions and having choices to choose from. What sets us apart is that we have that 3D imaging technology right here in the office. The patient doesn't have to go anywhere else. We don't have to wait for a week until this image comes back to us. Things can be done right away. What we have in the office is a 3D cone beam scanner made by iCat, which is the leading manufacturer of cone beam in the US right now. The images are superb. It gives you the most accurate imaging for dental procedures. And what it does, it pretty much puts the 3-dimensional object we're working with into 3 dimensions, where we can see all the structures that are present, the nerves, the teeth, the bone, the soft tissue, so we can accurately treatment plan the position and even the outcome of the treatment before we even start. The benefit to the patient is when you do a 3D image before you do certain procedures, especially like implants or removal of impacted teeth, there are no surprises. 99% of the cases, it's right on point, and we know exactly what we're dealing with. We go in, we do the procedure, we're out, procedure time is shorter, the risk of potential adverse outcomes is less. It's peace of mind of knowing that you know what you're getting yourself into, and you know to a high level of certainty that you're gonna get the result that you want.